Well, good morning, everyone. We wanted to come out today at the end of the week after what has been, I guess, an unsettling week for many Islanders. We've been through this before, of course, but it certainly isn't, and it probably will never be any easier anytime COVID does rear its head here in our province. But as Dr. Morrison and I have said from the very beginning that the only way we could get through these challenging times is to stay united. And the last 2 weeks have reminded us just how much that our province is united. Islanders are committed to keeping each other safe and healthy as we await the rollout of the COVID vaccine, which Dr. Morrison will talk a little bit about more in a second. I just wanted to come out today to offer some thanks and some gratitude, specifically to that demographic of 20 to 29-year-olds in our province. Last Sunday, we sat here and asked those in the age group to heed our advice and to get tested. And this was the first time since March that we had asked and had to make that plea. And it was probably a little bit unsettling for us to make the ask, and I certainly know it was even more unsettling for each of you who were sitting at home watching to hear that request. But not only did you show up in droves to follow the advice, you were patient, you were kind, you didn't complain, you didn't overreact, you listened attentively and followed the advice of the Chief Public Health Office, and along the way you sat in lineups, you were polite and courteous to our testing staff, and you stayed united with your peers by staying apart to ensure we stopped the spread of this virus. And I can say as Premier to all Islanders that our province is in good hands with this next generation. They know and embrace their civic duty. They know they have to be part of the solution, and they are the first to step up when they are asked. And that is just a great comfort for all of us. We're so very proud of the actions over these last 5 days and really throughout that has allowed us to sit here today and say more confidently that we seem to have more control over this recent outbreak than we had probably thought on Saturday. Next, I want to thank the hundreds of employees that have worked around the clock throughout the week, to Dr. German and his team at the provincial lab, who have processed a record number of tests again this week. Thank you very much. We know the strain that is caused when we see increased testing like this, but you have responded in a big way, and we appreciate that. To the public health staff and the team at Health P.E.I. under the direction of Marion Dowling, you greeted every patient with a smile. You answered all of the questions of those who presented to get tested, always putting Islanders first, and that means the world to all of us, and all Islanders certainly appreciate that. To the crews of the auxiliary staff from Island EMS, Transportation and Infrastructure and Energy, and so many other departments who pulled together to assist with traffic control, screening, and to make our testing regime as efficient as possible, thank you very much. To UPEI and Holland College for partnering with us to do on-campus testing for students, for pulling together facility space. These two institutions have been with us each and every step of the way during this pandemic, and we're extremely grateful for that leadership, for that partnership, and that friendship. There are countless other groups, from our IT staff to our 811 call operators, our contact tracing team within CPHO, and so many more. I think if Islanders really saw how these individuals go about their work every day, and the stress that they are under, but how they go about their day with a smile, and just a desire to get everybody through this. It really is, it's an amazing effort, and I am so grateful for how they go about their work every day. All of that to say, we aren't out of the woods here yet, but we sit here before you knowing that we're in a much better position today than we thought could be possible last Sunday. The last 2 weekends, Dr. Morrison and I had absolutely no intention to be sitting in front of you with unscheduled news conferences, but they were required to keep Islanders informed. That being said, I don't want to speak for Dr. Morrison, but I really don't want to see you or others this weekend. But To do that, we need everyone to follow the advice, to stay apart, to stick to your household, and to limit your contacts. On Monday, we began a 14-day circuit break, and we said we would reevaluate daily. Seeing what we've seen, I think it's safe to say we can begin to have conversations about what next week could look like. That doesn't mean we're moving right now, but we're beginning to have the conversations, which is a much better place than we even could have thought last Sunday. It will be a slow replug in from the circuit break for sure, if we're able to do that. But we have a number of challenges ahead of us, and we have a lot we have to watch before then. But I think Dr. Morrison will talk a little bit more about that in a moment as well. Let's hope and continue to be careful that we can have that conversation earlier than later. Finally, I would just say that the light at the end of the tunnel, I think, is getting a little bit brighter. We have vaccines arriving next week. We've had 4 days of 0 cases. We've had a record number of islanders tested this week, and people are following the advice from Dr. Morrison, and that has been extremely helpful. But even though we can see that light, let's remain vigilant, let's stay united, let's stay together in our effort to stop the spread of COVID-19 in this province. We've been doing amazing work. We just need it to continue. So with that, I'll turn it over to Dr. Morrison and for her update.
Thank you, Premier. Good morning. I'm happy to report there are no new cases of COVID-19 in Prince Edward Island today. So in total, we have 12 active cases that are self-isolating and doing well. This past week has been challenging for all islanders as we managed this outbreak in the greater Charlottetown area. And we implemented the circuit breaker measures to enable us to get the outbreak under control and to limit further transmission of COVID-19 in our province. Over the weekend, between the 5th and 7th of December, we announced 11 new cases of COVID-19, and the cases are contacts of one another, so they are epi-linked, and there's no confirmed connection to out-of-province travel. 9 of these cases are in their 20s and 2 in their 30s. And we have not yet identified a source or index case for this outbreak. And on Monday, the 7th, and for a 2-week period, the circuit breaker measures were implemented to limit the size of organized and personal gatherings and certain services. And that's really to try to, again, minimize the potential spread of COVID in this province. And in order to gauge if COVID-19 is circulating in the 20 to 29-year-old age group, as has been the case in other provinces, we took steps to increase the testing of individuals in that age group in the greater Charlottetown area, even if they did not have symptoms. Young people listened to this recommendation and they responded. And their response to the recommendation for testing was overwhelming. I would never have predicted that so many young people, probably certainly over 4,000 people aged 20 to 29 would be tested in that period of time this week. To date, 3,500 tests have been analyzed and all are negative. Approximately 1,300 tests are still pending in this age category. Knowing that these tests to date are negative is reassuring. And given the large volume of tests completed, the negative results, and appreciating the demand on laboratory capacity, beginning today, the testing focus for individuals aged 20 to 29 will be those who are experiencing symptoms of COVID-19. Going forward, our office will work with employers and others to continue to focus testing on individuals aged 20 to 29 who may be living with others in the same age group or work in crowded spaces, such as fast food restaurants. All of the close contacts of the cases associated with the outbreak last weekend will be retested, and they'll be retested over the next few days. Given they are in self-isolation, if any of them are positive for COVID-19, they will have very few, if any, further contacts. As the Premier mentioned, it may be still early to be certain of the impact of the circuit breaker measures, but I am cautiously optimistic they are making a difference. I think next week we'll be able to give a clear indication of what coming out of the circuit breaker measures could look like. And we may be able to plug back in, as the Premier said, plug back in slowly. I know that would be appreciated by all. We're currently reviewing how we may be able to come out of the circuit breaker maybe a little bit earlier than anticipated, but much will depend on the next few days. Certainly, when we're speaking about testing in this age group, a special thank you, as the Premier's already pointed out, to the laboratory and testing clinic staff who worked tirelessly. I know a very challenging few days for them to complete the record number of tests. And thank you to Health P.E.I. and Island EMS for arranging these extra clinics at various locations to improve COVID-19 testing access. So thank you to all involved for your dedication to the COVID-19 response and the commitment to providing high-quality service to Islanders. We are pleased that the vaccine is arriving. And I have to say, I didn't think we would be starting to administer vaccine in this province in December of this year. Health Canada approved the Pfizer COVID-19 vaccine earlier this week. And this is a big decision and a turning point, I believe, in our journey with COVID-19. We are expecting the first shipment of the Pfizer vaccine to arrive in this province early next week, and the first clinic to start on Wednesday, December the 16th. The arrival of the vaccine in December is the beginning of many months of a COVID-19 vaccine program rollout. Everyone in P.E.I. will have a chance to be vaccinated, but it will take some time. Every province, not just P.E.I., will be getting vaccine in small amounts. This first vaccine that's arriving, the Pfizer vaccine, is a 2-dose vaccine, meaning a booster dose is required 21 days after the first immunization. And there are other vaccine candidates currently being reviewed by Health Canada. This Pfizer product that's arriving has to be stored at -75 degrees, and the initial shipments cannot be moved from the location where the vaccine is delivered at this time. This means that the vaccine has to be administered at the location where it is dropped off. So we will be receiving an initial shipment of 1,950 doses of the Pfizer vaccine early next week. And we plan to begin administering the first doses of the vaccine on Wednesday. More vaccine will arrive by the end of December, and regular weekly shipments will start arriving for the next few months. And subject to regulatory approval, we do anticipate receiving Moderna, which is another 2-dose vaccine, to arrive in the province within the next month. And this is a vaccine that can be shipped much more easily out to different locations, and the intention would be to move this quickly to long-term care residents across this province. These first shipments of vaccine will be used when they arrive in the province to immunize frontline healthcare workers who are involved in the COVID-19 response and long-term care staff who have direct patient care. And those people who will be contacted in the next few days will be booked for an appointment to receive vaccine. While eventually there will be enough vaccine for everyone on P.E.I. that wants to be immunized, these first few months will focus on the priority groups. And we will be following national recommendations from the National Advisory Committee on Immunization regarding the priority groups to receive the immunizations. Our system is fully prepared to receive, administer, record, and report on vaccine as soon as it arrives in the province. And the protocols and reporting requirements for these vaccines are stringent. P.E.I. can meet all the required standards for handling and administering the vaccine. but we know the logistics for administering the COVID-19 vaccine are challenging. We have received generous offers of support from island businesses and organizations, and we've also received support from representatives of the Canadian Armed Forces who have expertise in logistics and planning. By immunizing our priority populations and doing so early in the vaccine program, it will benefit everyone in P.E.I. I would like to see, over time, P.E.I. achieve 75 to 80% uptake of the vaccine. And if we can, this will protect all of us and those who may not be able to be immunized. And this will allow all of us to maybe live a little differently at some point in 2021. I again want to reassure that all islanders who want to receive the vaccine will be able to do so in the coming months. If you had asked me in March, I would not have imagined that we would be administering a COVID-19 vaccine in P.E.I. before the end of 2020. The prospect of having access to a vaccine is a significant guidepost on our COVID-19 journey, and it is an indication that we are coming through this pandemic. And while the finish line is still off in the distance, it is within sight. The events in P.E.I. in the past week are also a strong signal that we cannot let our guard down against COVID-19. We continue to be at risk of COVID-19 transmission. We have to continue to support one another and follow the basic public health measures that we know are known to be effective against COVID-19. And we say them every week, but wearing a mask in public places, washing your hands often, maintaining physical distance of 6 feet from people outside your household, keeping your circle of contacts small, staying home when you're not feeling well, and getting tested if you develop any symptoms of COVID-19. And always, we encourage everyone with smartphones to download the free National COVID Alert app. And the Premier mentioned gratitude, and we've talked at different times through this pandemic about an attitude of gratitude, and I share that today. An attitude of gratitude to the young 20 to 29-year-olds and to all islanders who have been so involved in this response and done their part, and to the health system, public health nursing, lab and testing team, and to all our partners, and that's enforcement, those at the bridge, those doing pre-approval travel, the 1-800 line, those making calls for Operation Isolation, and also gratitude to my team in the Chief Public Health Office. So as we take yet one more day on this COVID-19 journey, let us continue to be patient and kind. Thank you.
Thank you, Dr. Morrison, and we will now turn it over to some questions from our friends in the media.
Heidi Petrasic, CTV.
Hello, thank you. Dr. Morrison, I'm thinking the dry run has happened now. How would you describe it went?
Yes, hi. So the dry run happened earlier in this week, and for those, just to be clear, the dry run is where they there's a practice run of shipping the boxes, almost pretending there's vaccine in place to make sure that it's received, it can be stored properly and hooked into the controls and the monitoring system. And so all went very well, and so we were pleased and also excited a little bit because it signaled that vaccine really was going to start coming.
And a follow-up, just in terms of where the first vaccinations will happen, where would that be in general? Like, are we talking the Charlottetown area or somewhere else?
Yeah, so as I mentioned, the Pfizer product, and this is true, of course, across the country, the Pfizer product at this point in time, to receive it had to be have certain criteria. So the -80 freezer in place, being able to be hooked up to monitor, and and some of the details around where it arrives, and also where it arrives, that's where the initial vaccines have to be administered, and it has to be in a hospital location. So it will be here at our main hospital, the Queen Elizabeth Hospital in Charlottetown, and that is where these initial clinics will be held, and that has to do with the logistics around the arrival of the vaccine and where it has to be administered.
Nicole Williams, CBC.
Hi to you both. Dr. Morrison, I'm wondering if you could just be a little more specific on what's going to happen on Wednesday. You know, how do you choose which specific healthcare workers will get the vaccine first? Do those people already know? Do we know if it's hospital staff first or doctors' offices? And also, what about seniors and long-term care residents? How do you prioritize within those people who gets the vaccine first?
Hi. So I think there are a number of questions in there. And so long-term care residents, I think I mentioned it before, but I need to be clear. The long-term care residents can't come to the vaccine. So as soon as we get the anticipated Moderna vaccine in, which is also a frozen product, that's the vaccine that we can take out to long-term care residents. So as soon as that vaccine arrives in the province, that is the vaccine that will go to long-term care residents. In terms of long-term care staff and healthcare workers, again, long-term care staff with direct patient care and healthcare workers who are involved in the COVID response. We can't do everyone at once, but they will be contacted. Healthcare workers, for instance, there would be paramedics, there would be the people involved in testing, public health nursing, emergency departments, and for instance, those are the groups. I am being provided a final list of the groups, and they need to look at the numbers of vaccine we have and try to get as many people done. We hope to vaccinate close to 1,950 because that's how many doses of vaccine we're getting in, and do those over a very short a number of days. We feel we can probably vaccinate approximately 400 to 500 in a one clinic day. And so that's what we'll be doing. The healthcare workers, both long-term care staff who will be identified, as well as healthcare workers, will be contacted over the next 3 days. We'll have someone will be making lots of phone calls, and those appointments will be done. It will be by scheduled appointment only, and these appointments will be made when with the contacts with these healthcare workers. And this, of course, is quick. It's hard, but this is also the beginning and of a really important vaccine rollout, and knowing that in the first 3 months of 2021, our residents of long-term care, our long-term care staff, our healthcare workers involved in COVID response, they're all going to be vaccinated and it'll be made available to them. So those groups will get done in these next couple of months.
Thank you for answering that very jam-packed question. I'm also just wondering if you could tell us a little more about Moderna. I'm just wondering if you know how many doses of that we'll be getting and when we can maybe expect that to arrive.
So we, of course, Moderna has not yet received the approval from Health Canada, but once it does, we would anticipate it coming certainly within the next month. And I'm thinking it will be here by early January. Of course, lots of steps along the way, but those numbers in terms of shipment numbers as well as confirming the dates, we do not have those yet. We have some numbers for planning purposes, but we will not know those. But once we do, we'll be letting you know exactly those confirmed numbers and the dates of arrival.
Thank you so much.
You're welcome.
Stu Neatby, The Guardian.
Hi, good morning to you both. I guess first question to Dr. Morrison. I'm actually wondering if, I guess, details of the second wave of vaccination have been sort of figured out yet, specifically which essential workers would be included. Like, for example, do you include grocery store staff or early childhood educators, teachers? You know, when does that sort of come into play?
Hi, Stu. So, as you point out, the sort of second wave of priority groups, and these are essential workers, are identified in that second phase priority group. But we have had some discussions, no confirmation at this point in time, and we're having discussions nationally, of course. For instance, we've talked about the essential workers in our province as rotational workers, for instance, and truck drivers who are having to travel in and out of the province, particularly essential workers that may have higher risk of importing COVID-19 into the province. So they would be essential workers that we would be looking at. But we have that has not all been confirmed. There is a group of people talking about it both nationally and provincially. So. Our focus for this, certainly for this week and the next couple of weeks, is to get our healthcare workers who are frontline, and we need to sustain our health system, and want to get our staff at long-term care facilities vaccinated, as well as the residents. And I think those are pretty consistent groups across the country that are being early priority groups, given some of the logistics around these vaccines as well.
Okay, thank you. And I guess just in terms of, the positive cases in recent weeks, I've heard some accounts that there might have been cases linked to manufacturing facilities, like workers who have tested positive. Wondering if you can confirm that, and if so, what steps have been taken to ensure the safety of other staff?
So any case that is identified, then wherever they are working, we go through their close contacts. So anyone they may have eaten with or worked with in close proximity, and then they are identified as close contacts. They are tested and put as close contacts, even if they're test negative, are put into isolation for 2 weeks. And that's what has happened previously, and also happened related to any of the last cases that we had on the weekend.
Can you confirm whether there have been cases identified with manufacturing facilities?
Yes, there was a case identified with a workplace. That was not eating establishment, and it was not a public, didn't have public exposures.
Gabrielle Drummond, Radio-Canada.
Bonjour, Dr. Morrison. Bonjour, Premier. Ma question pour la Dr. Morrison en français. Je sais, Dr. Morrison, que vous avez parlé de ce sujet en anglais. J'aimerais que vous nous parliez en français sur cette première journée de vaccination mercredi prochain. Comment allez-vous procéder dans cette journée-là? Quels sont les groupes prioritaires? Et qu'est-ce que ces personnes vont devoir faire pour se vacciner mercredi prochain? S'il vous plaît, en français.
Bonjour. Je vais essayer. Alors, le vaccin, le Pfizer vaccin arrive à l'île du Prince-Édouard la semaine prochaine et puis la première clinique commence mercredi. Et puis, c'est pour les personnes qui travaillent. On commence avec les groupes, avec les personnes qui travaillent à les édifices long-term care et puis aussi les personnes qui travaillent directement avec, à partir de la COVID response. Alors, les personnes peut-être, les personnes avec les cliniques de COVID, les personnes qui font la test, de COVID, les personnes avec à l'urgence. Et on va, les autres, il y a des personnes qui on fait une liste de ces personnes et puis on va les contacter. Alors, pour la clinique en mercredi, c'est seulement les personnes qui ont en contact dans les prochains jours pour recevoir le vaccin. Et c'est un processus, on commence et puis on va avoir plus de vaccins dans les semaines qui suivent. Et puis on va faire de plus en plus quand le vaccin arrive ici à l'île du Prince-Édouard, on va continuer d'administrer.
Merci. Ma deuxième question, c'est par rapport justement à la deuxième dose de ce vaccin, parce que ce vaccin, il est administré en 2 doses. Donc, ces personnes vont prendre cette première dose mercredi, puis après 21 jours, ils vont en prendre la deuxième. Alors, ma question, c'est est-ce que ces personnes vont devoir prendre des précautions en attendant cette deuxième dose-là? Est-ce que vous allez donner des instructions en particulier à ces personnes et comment allez-vous faire le suivi avec eux pour la deuxième dose?
Alors, de bonnes questions. Même après le premier vaccin, vous n'êtes pas encore tout protégé. Alors, il faut quand même continuer de suivre les mesures de santé publique, même après la première dose de vaccin. Et puis, quand vous venez pour la première clinique pour le vaccin, on va on va faire les plans pour de retourner pour la deuxième clinique. Alors, et puis, ils sont en train d'organiser que ça va être organisé vraiment depuis ton première clinique de retourner 3 semaines après. Oui, je pense que c'est ça. And I may repeat that. I realize that I didn't answer part of Stu Neepy's question, which was the same, and that there are 2 doses of vaccine we mentioned for the Pfizer product. It's 21 days for between your 2 doses. And so the appointment for the second dose is going to be really made at the time of your first clinic. And there'll be clinics for those second dose appointments. And I think, Stu, you may have asked about that as well. So there'll be clinics run for those second people requiring the second dose. And note that the Moderna product, which we anticipate going into long-term care, will have a slightly different second dose or regimen. It's anticipated it will be more of a 28-day dose, but that will be finalized as well when it goes through Health Canada.
Parfait, merci beaucoup.
Okay, merci.
Allison Jenkins, The Guardian.
Hello, yes. I have a couple of questions about the vaccine, just really, really granular ones. So just to reiterate the question from my colleague just previously, during those 21 or 28 days between the doses, you say to continue to follow the public health measures because you're not fully immunized? And how long after the second dose are you considered immune?
Good questions. The National Advisory Committee on Immunization has said, really, from what they know of this, what the advice is on this first vaccine is that you need the 2 doses of vaccine and at least 7 days after that second dose to be considered sort of more protected. And that's similar to the advice we often will give to people who get even the influenza vaccine, that really we know that the effectiveness of it and the protection really doesn't happen for about a week after in terms of mounting the immune response. So that is the initial direction from NACI. But the second part of the question is really important too, and that's why we are going to be having some of our public health measures staying in place until we can vaccinate a larger number of people. The long-term effectiveness of the vaccine is still not fully known, and I think we'll learn more about that. And the question is, will we need to get a second dose, 1 year, 10 years? We don't know that yet, and that will be determined. I will say that, and I may get asked this at some point, will I get the vaccine? And I would absolutely get this vaccine in a heartbeat. And we'll have to see where I fit in the priority groups. But when my turn will come, I will look forward to getting this vaccine.
Oh, thank you very much. And my next question, is it a really cold dose that goes in your arm? If it has to be kept, it sounds like it's quite volatile because it has to be kept so cold and doesn't tolerate. But we're not getting a negative 75 degrees vaccine in our arms, or what are we?
No, it's not. You're not getting the frozen product, but it is. It's thawed out and then it's administered, and it's really about the stability of the vaccine and how it's stored. That is why it needs to be kept frozen in terms of shipment. But then it's thawed and administered.
Okay, thank you very much. Appreciate it.
Louise Martin, CBC. Hi there. Good afternoon to both of you. Good morning still. We're 1 minute away from afternoon. Okay. Dr. Morrison and Premier King, you both mentioned that we could be able to plug back in slowly next week. Can both of you be a bit more specific about what that might look like and whether you have sort of concerns about lifting too quickly ahead of the busy holiday period and, of course, more gatherings?
Do you want to take the first
Sure.
Yeah.
Hi, Louise. So I think, as we both have mentioned, that we are certainly able to take a look at how we would start easing up the circuit breaker measures, not only if it's the 21st, but even if we were able to lift them a few days earlier. It will depend on how the next few days go. I think you absolutely raise the concern that we both share, that if you do too much too quickly, then we can end up having to get back into another situation. So we do have to, any easing up of the measures would have to be done cautiously, recognizing that it is a time of year where we do know there are additional people coming into the province. We have students returning, we have people traveling, and so that is something we will be taking into account as well as we look at these restrictions being eased up a little bit. But we also would like to see, if possible, and if we can do it safely, for instance, possibly having slightly larger numbers of people together, recognizing it is an important time of the year. I don't know if...
Yeah, no, I just add that, I mean, some of the things that we just talk about on a very preliminary basis would be with the time of year, obviously, family, faith-based gatherings, for example. This is a big, important time for religious purposes, obviously, as we move into this season. And we're very mindful of that. So, I mean, those would be the areas we'd look at, perhaps some softening of organized sports and activities for kids if possible. But it is a bit premature. I think we just really wanted to indicate today that if we continue on this path that we are on right now currently, that we're able to have that conversation earlier than we would have anticipated. So I think, and to me, that's a really good thing. It's a positive thing. But we also have both continually said we're not out of the woods here yet, and we wouldn't want anyone to start to move too quickly here. We moved quickly to get into the circuit breaker situation because the advice from other jurisdictions has been, as Dr. Morrison has said repeatedly, to go fast and go hard, and we did that. And I think that's played a huge role in the fact we're talking about this today. So we won't plug back in as fast and hard as we pulled the plug for obvious reasons. But I think it's exciting that we're having the conversations, at least.
Thank you very much. And my second question is for Dr. Morrison. This morning, Dr. German in the lab told us that rapid testing was actually being used at P.E.I. in the clinic that we saw there yesterday. I'm just wondering when the province started to use the rapid testing. I know you had we had talked about this before and you were waiting for more data on it. And are there any plans to expand rapid testing to other places on the island, maybe like schools, etc.?
Hi, Louise. So this is there's different types of rapid tests, and this is actually the tests that were used at UPI yesterday were a particular kind of rapid molecular tests, which are different than our other rapid antigen tests, and I think it's great to be able to have that. It's not. It's something that we can almost use more as a population level tool, which was what was needed yesterday, and so I think that's a discussion. I know Dr. German and I spoke as well earlier this morning, and it's a conversation we want to have over the next few days of where we might be able to use this. So this is an ongoing discussion. It's again, it's not always for diagnostic purposes individually. There still needs to be confirmatory with PCR testing for any positive tests. But is it something that we can use to help us in the weeks and months ahead? So it's a conversation we'll be having, and it was the first time we had used that yesterday.
Appreciate that. Thank you both very much for your time.
Danielle, Canadian Press.
Sorry, I was muted. Hi, I think this question is probably best directed to Dr. Morrison, but I was curious if there are ever going to be sort of rules placed around getting vaccinated in P.E.I., or will it remain sort of a voluntary vaccine that people can get if they choose?
At this point, we do not have mandatory vaccination in this province, and it is not the intention at this point in time to do mandatory vaccination with COVID vaccine. But Prince Edward Island has a long history of very good vaccine uptake. We have great vaccine uptake amongst our children and a very great vaccine acceptance in the population. And I think that will really serve us very well as we go into the months ahead. We have a vaccine registry already established, so for children and adults, so we are able to track that vaccination well. And but I know it is a discussion that is happening across the country. But at this point, that is what our thinking is.
I just add, Danielle, that it was a topic of conversation yesterday at the First Ministers meeting when we talked in the morning with Dr. Tam and others about the vaccine. And it's across the board from all premiers that this is a voluntary process right now, and there is absolutely no indication or interest in anyone moving beyond that to move to mandatory. And I did talk briefly, as Dr. Morrison has just outlined, that the position we're in here as a province and the expectation we have that Islanders will want to do this as soon as it's made available to them.
Okay. And the second question I have is just about a case that that came up. Well, sorry, not a case, but the 2 freezers that were donated by Jason Tompkins of One Tuna. I just wanted to ask you, Dr. Morrison, how that's going and what that means for the storage of the vaccines.
Well, I mean, we were so pleased, of course, to have Jason reach out to us with that offer. These were great new freezers. One will be used for storage, one for backup, and because we didn't anticipate initially the vaccine arriving as early as it's going to arrive. So this has been something that he reached out very quickly, very early on, and so we had that connection, and we were just thankful. We spoke about attitude of gratitude, and that would be one more person on that list for sure.
Okay, thank you both.
Thank you. Well, I believe that brings an end to it. So I once again thank you, Dr. Morrison, and thank all Islanders for doing your part. Continue to do it this weekend, and we really hope to see you on Tuesday. All the best.